We have another COVID-19 update for you with Dr. Brian Harrington. Doctor, how are you doing this morning?
I'm doing well. Good morning, Eric.
Good morning. Hey, so we've been kind of seeing a general trend of decline of cases. What's going on with that?
Well, I think we did, as predicted, see a kind of a local surge of cases after the Labor Day weekend. And so as we moved into October here, we were at a higher case count. And then here in the last couple of weeks, we've seen that drift back down. The last 2 weeks, we had a total of 13 Routt County residents who tested positive. In addition, we had 7 other individuals who were out of county residents test positive. Of our cases in the past week, several of them are what we would consider a more reassuring story in the sense that they did have contact with a known case. So, for example, we had a few family members of known cases. So that we take some reassurance from that because we imply from that therefore they weren't just getting it from somewhere out in the community. And of course, those people were all in quarantine already anyway, for the most part. So that's the right direction of what we want. It's not down to zero, but that was certainly better than we were here a couple, 3 weeks ago.
And so it's my understanding that there is a possibility and or talk of some of these kids, some of the students going back to school in person full time, as opposed to what they're kind of doing right now, which is cohorts and going in online halftime, in person halftime. What's the deal with that?
Right. So 2 of the school districts in our county did start with full in-person education for their K through 5 levels. That's South Routt and Hayden. The Steamboat School District elected to take a hybrid approach initially. That has gone well. And as we had discussed before the school year began, there was hope that we might eventually progress that to full in-person. And so the school district is now making those plans. Their initial plan is to open up K through 2, and then soon after, hopefully open up K3 through 5.
That's exciting. That's in the next couple of weeks potentially, and then they do like a 3-week trial period of that, and then possibly open it back up, or is it like a 2-week, 1 week?
I don't think we've decided exactly on the time frame, but I think I also would argue that if we're going to do this, that now would be the time to do it, not wait another month or two, just because our case count right now is, I think, manageably low. And that probably gives us a little bit of leeway to make mistakes or learn from what we're doing without necessarily seeing rising cases in the schools. I think if we got into December, when we expect we'll probably have more cases locally, there the margin for error is a little less. So I think this is an appropriate time to try this. I know we have a lot of parents and families in the community who are anxious for this because obviously this has created challenges for those families to juggle how they take care of their young children during the days when they're not in school and still work as adults.
Yeah, I completely get that. My wife is a elementary school teacher here in town. And I know the standards that they have in place and the desks being far apart, everyone wears a mask. You had talked about the kids being at home, and while they're at home, they're playing with other kids, which is arguably not as safe. And I think I can agree with that statement there.
And we want to watch out, though. I mean, I know the public health department, we're going to monitor this closely, and we talk frequently with the school. We have concern, obviously, for the teachers and staff, because this isn't just about students, it's about the teachers and staff at our schools. So there's, several groups of people that have a vested interest in this going well and going safely.
So the general trend is going down. We've had a couple new cases going around town. Do you want to talk about those at all?
Yes, we just have. So while our overall cases the past couple of weeks were better, since that data was tabulated, we do now have an outbreak amongst staff at Casey's Pond, our local skilled care facility in particular, in that section. We are waiting on other test results to come back. And at the time that you and I are having this conversation, we don't have any residents who have tested positive. But this is certainly a concerning event. We've seen this happen in our county twice before. So back in the spring, after our first wave of cases, we saw an outbreak at Casey's Pond. here in July, when we had a second significant kind of surge or wave of cases, if you will, we ended up with an outbreak at the Haven, which is the assisted living facility over in Hayden. Here in the past month, end of September and into October, we saw another surge of cases, presumably related to the Labor Day weekend to some degree. And here we are again with another outbreak amongst one of our vulnerable populations. I would suggest that there is a relation to that. When the prevalence of disease in our community gets bigger, it just means it's more likely that especially our vulnerable community members are at risk of contracting it, and not necessarily through any fault of their own. And I think this point highlights that even though many individuals personally have a low risk if they get COVID-19, it isn't only about them. If individuals, even though they're doing okay, get COVID-19 and we increase the presence of it in our community and therefore the risk of spreading it, that increases the risk to the people with whom we live and care for in our community. And that includes vulnerable populations such as our older residents and invalided residents at some of our skilled care facilities and assisted living facilities.
Casey's Pond, we've beat this before. Let's do it again.
Yep, that's exactly the attitude. They've got the knowledge and ability, and they were successful before. They're going to be successful again in containing this and getting rid of the outbreak over there. And I would highlight, at the time of you and I are talking here, so far we only have positive cases among staff, not residents. And this only involves the Doak House, which is our skilled nursing component at Casey's Pond.
And so I'm assuming all those 5 staff are going into self-isolation?
Yes. Yep. They've all been in, already started that process. And Casey's Pond does weekly tests of all their staff. That's actually how they found this. None of these staff members were positive, but their own measures of screening for it in their population were effective in finding these positive staff members. And so they have we've kind of got a good process that we certainly learned before that gets employed with now extra use of PPE equipment. We have conversations with contacts at the State Public Health Department and these individuals focus just on outbreaks at skilled care facilities. So we're trying to bring to bear all the knowledge and resources that we can to stop the spread of this any further.
Well, Dr. Harrington, thank you for all this information. Thank you again for joining us on air and sharing with the community here in Rowan County the latest COVID updates. So thank you so much.
Yep, always great to have the opportunity to speak with you, and have a good week.